Hi, everyone. I'm Katie Couric. Did you know that over 69,000 women in this country will be diagnosed with uterine cancer in 2025? And sadly, nearly 14,000 of them will die from the disease. Endometrial cancer, a type of cancer that develops in the lining of the uterus, makes up about 90% of all uterine cancers. The number of cases of uterine cancer is rising, even as many other types of cancer rates decline. And yet, endometrial cancer is still one of the least talked about cancers that impact women. Today, I am very honored to be joined by Cheryl, who is a survivor of stage 4 endometrial cancer, and Dr. Angeles Alvarez Secord. She is a gynecologic oncologist, which is always a mouthful, who has dedicated her career helping women facing cancer. We're here to have an open, honest conversation as part of a program called Our Way Forward, which offers resources, personal stories, and tools to help people navigate their experience, whether they're living with gynecologic cancer, caring for someone who is, or working in healthcare. Because beyond the physical toll, an endometrial cancer diagnosis can have a huge emotional impact on the patients and their families. And that is why I'm so grateful to be here with Cheryl and Dr. Secord to have this conversation. Thank you both so much for being here. I'm really looking forward to talking to you and learning more about this. So I thought I would start, Dr. Secord, by asking you what exactly is endometrial cancer?
Well, Katie, thank you so much for having me on this program and for getting this word out. And Cheryl, thank you so much for sharing your story. Endometrial cancer is the most common gynecologic cancer in the United States. Uterine cancer and endometrial cancer are often used as terms interchangeable. And that's because endometrial cancer is the most common type of uterine cancer. As you mentioned, Katie, like 90% of uterine cancers are endometrial cancers. Endometrial cancer comes from the lining of the uterus. And that endometrial lining, that inner lining, has a very important role in the menstrual cycle. So, when people start having their periods to the point where they go through menopause, that lining changes throughout the menstrual cycle. It thickens in preparation for a pregnancy. And then, if there's no pregnancy, that lining will thin and then slough off during the menstrual cycle. If there is a pregnancy, that lining stays in order to support the pregnancy.
That's so fascinating. And as you said, I think so many people really haven't heard much about this particular cancer, Cheryl, including you before you were diagnosed. Had you ever heard of endometrial cancer?
Well, thank you for having me here today, Katie, and also you, Dr. Secord, to spread the word about endometrial cancer. Because before my diagnosis, I had only heard of ovarian and cervical cancers. I had never heard of endometrial cancer, nor was there any history of any gynecological cancer in my family as well.
I'm curious, Dr. Secord, do you find this to be the case with most of your patients that they come in and they don't have a lot of knowledge? As Cheryl said, we do hear a lot about other cancers, but endometrial hasn't gotten much attention.
Cheryl's story is so common. That's what most of my patients will say, that they've never heard of endometrial cancer before their diagnosis. So, unlike breast or cervical cancer, where that's really commonly diagnosed and recognized, endometrial cancer and the other gynecologic cancers are really under the radar. I think there's something about these cancers that are under the belt that people just don't feel as comfortable about discussing them. And that really contributes to the lack of public awareness and education. And, what this we have to change that, and that's why I'm so thankful you're having this program today, because often people are surprised by their diagnosis, and they were never aware that things like abnormal vaginal bleeding or spotting could signal something more serious.
Well, that's such an important point because Cheryl, talk about the symptoms you had before you were diagnosed.
Well, when I was first diagnosed, one of my symptoms was loss of bladder control. I think it was probably going on for about a year until finally I had a discharge, which eventually would increase in volume and change color. The loss of bladder control, I just passed off as part of aging, you know? as we get old. But when it wasn't until the discharge that I noticed that I thought maybe I should make an appointment with my primary care doctor. So I did. She gave me an exam, which included a pap smear. I had never had an abnormal pap smear my whole life. So then she sent me to a gynecologist, and she did an ultrasound and eventually a biopsy, which led to my diagnosis.
Dr. Secord, that's so interesting, the symptoms Cheryl experienced. And I think it is so tricky because some of these symptoms you can kind of just think, oh, this is a normal part of the aging process. So tell us about the symptoms and particularly when you need to be really aware of what's happening and how it might differ from like just getting older.
Right. So Cheryl's story is really interesting because her symptoms are not the typical symptoms you'd see with endometrial cancer. And I want to come back to the symptoms that she had and why what she did and how she sought care is so important. So, the typical symptoms of endometrial cancer are spotting and abnormal vaginal bleeding. And after menopause, they should never be ignored. These are the most common symptoms of endometrial cancer. Menopause is when menstruation has stopped. And if you've had 12 months in the absence of having a period, when you're older, it's a sign that you've gone through menopause. And so, again, abnormal bleeding or spotting after that, you need to seek medical care. Because even if you've gone through menopause, that inner lining of the uterus that has not gone away, that is still there. And that's where this cancer develops. So, what is so interesting about Cheryl's story is this symptom of the change in her bladder function and then this vaginal discharge. So, another symptom of endometrial cancer is this abnormal vaginal discharge. And she saw a doctor, and the doctor did exactly the right workup. Going to see a gynecologist, getting the biopsy, having the ultrasound were really key in order to diagnose her with endometrial cancer. And then for her to see a gynecologic oncologist for the correct care.
Dr. Secord, I understand that you're seeing a lot more younger patients present with endometrial cancer. Why do you think those numbers are on the rise?
Yeah, they are definitely on the rise. I mean, endometrial cancer typically occurs in postmenopausal women, and the average age is 60 years of age. However, just as you mentioned, we're seeing this in younger and younger women, and there's a lot of different potential causes for that. So, one could be higher weight or obesity as a risk factor. We know that can stimulate the lining of the uterus to grow and develop into endometrial cancer. There's a syndrome called polycystic ovarian syndrome, which is pretty common. A lot of people may not even know that they have that. That can also increase the risk. And there's also a syndrome called Lynch syndrome, which is an inherited genetic predisposition. You inherited a gene from one of your parents, and that syndrome is associated with a higher risk of endometrial cancer as well as colon cancer, ovarian cancer. And then there's also this thought that as women are waiting till they're older to have children, that could be contributing factor. So there's a lot of different risk factors. It's not just one of those things. And then the symptoms in premenopausal women can vary. So instead of having just a spotting, if they're having heavier cycles, if they're bleeding between their cycles or have that abnormal discharge that we've talked about already, and or pelvic or abdominal pain, those are all symptoms that should be a trigger that something may not be right and discuss it with your healthcare professional.
So, usually, should you go to your gynecologist when you're having some of these symptoms, Dr. Secord, or your internist, or I guess just any medical doctor, right?
If you have a gynecologist, that would be the first person I would call. Not everyone has a gynecologist, though. And if you don't, your family practice provider, advanced practice provider, internal medicine doctor can help you to get that referral. But advocate for yourself. If you're having abnormal bleeding, a pap smear is not enough to diagnose that. You really need a pelvic ultrasound. And in many cases, you need an endometrial biopsy.
Dr. Secord, I really admire oncologists because it's a very tough job and often very emotionally draining. I know you've had a number of relatives who have battled cancer. I do too, both my husband and my sister. And my nephew, the son of my sister who passed away from pancreatic cancer, actually became a gastrointestinal oncologist, I think motivated by his what happened to his mom. I'm just curious because I've asked him the same question. How do you deliver the news to patients? And how do you keep going when sometimes you're faced with so much sadness?
Well, it's never an easy conversation to have. I have had a lot of family members who've been diagnosed with cancer, and through their experience, that helps me learn as well. And so, even when you have to deliver bad news, you can do it in a way that also is hopeful. So, my sister's experience was really instrumental in helping me to determine my own best ways to deliver news. So, when she was diagnosed with breast cancer, her surgeon walked in the room and said, "How are we going to fight this and get you better?" And that message to her was so hopeful. And she shared that with me. So when I can walk in the room and say that to a patient, I will. But there's times that I walk into the room and I can't say that, but I can still say, how can we best treat you? How can we fight this so we can get the best possible outcome for you? And then that way, even in a bad situation where the prognosis is not good, we can still deliver this message in a hopeful way.
And so many breakthroughs are happening every day, which I think is so exciting. And Cheryl, from the patient's perspective, how did you approach the challenges you faced in getting better and with your treatment and kind of get yourself psyched into mentally handling this?
Well, Katie, I think everyone reacts different to the word cancer. My husband and I were in the gynecologist's office when we were told that I had a very aggressive form of endometrial cancer. My husband kind of broke down crying. I, on the other hand, turned to him and said, "Don't worry. I'm going to be fine. I'm not going anywhere. I have a 38-year-old daughter I need to finish raising," which is the truth. So at the time, I think I was kind of in disbelief that I even had cancer because I never felt sick. I was in no pain. I was walking every day, playing golf, riding my bike, doing all the things I enjoy. So for me, I just didn't even think I had cancer, to be honest.
Cheryl, can you tell us how you were treated for your cancer?
I had a total abdominal hysterectomy, followed 3 weeks later by my 6 rounds of chemotherapy. So I would have 1 treatment every 3 weeks for a total of 6 rounds.
And you called your chemo treatments your spa days,
Yes.
which is a great attitude, but I know you reframed it for yourself mentally. Um, Tell me how that made the process easier for you, and how do you think that positively impacted your mental health going through chemo?
Well, I wanted to put a positive spin on my treatments because I would be sitting in the chemo chair for about 7 hours. So during that time, I watched movies, took cat naps, read books, and the nurses I had were just wonderful. They would bring me warm blankets, pillows, water, whatever I needed. So I kind of felt like I was queen for a day. And I said, I'm going to start thinking of these as spa days because I wanted it positive. And, um, so I did that, and that helped a lot, reframing it to a more positive way of thinking.
You also, I know we were talking before we started, and I was complimenting you on your hair, and I had actually forgotten that losing your hair during chemo or as the result of chemo was really hard for you. I remember when my mom lost some of her hair because she had cancer and had a treatment that she it I didn't appreciate how distressing it is and how our hair is such an important part of our identity. And I think it makes you feel kind of out of control. How did you manage that, Cheryl?
Well, I was told that within the first couple weeks of chemo that I would probably start to lose my hair, and sure enough, 2 weeks after my first treatment, I would find myself shaving my head. I was okay having the hysterectomy. I was 67. I had already had my family. I had gone through menopause. But I think losing my hair, I think you lose part of your identity. Your hair kind of is who you are. Even though I have short hair and I've always had short hair, it was still pretty difficult. And also, I think by losing my hair, it made me realize that I do have cancer, you know? When it grew back, I thought, I'm never going to say I'm having a bad hair day because I know I used to say that. I'm having a bad hair day. But now, any day you have hair is a great hair day.
Amen to that. And you know that firsthand. And Dr. Secord, I think this is pretty typical. You go through cancer and, you know, it's a huge emotional thing, right? Whether it's losing your hair or honestly, having surgery, in Cheryl's case, a hysterectomy, where it does feel as if you're kind of losing a part of yourself. And I'm curious how you help your patients deal with all these side effects that may take even a bigger toll than some of the others.
Wow. Well, that is so true. And Cheryl said one thing, a word that was really perfect, and that was differently. Everyone approaches this differently, and different things affect different people. So, some of my patients are really upset about the idea of a hysterectomy and how it may impact their sense of their identity or their femininity. Whilst for others, like Cheryl, it wasn't as big of a deal. Alopecia for Cheryl was a bigger deal. And for others, it can even be more upsetting than what she relayed. Whereas some individuals don't necessarily care as much about their hair. And then the other thing you mentioned, Katie, was what about the other side effects? It's important to support individuals during this time, that you provide as much education as possible, that they also know to tell you about some of these side effects so that you can provide those supportive care medications. Because we can do a lot of things to try to make the symptoms better and tolerable to get someone through the chemotherapy that will help treat their disease. It's really about understanding what's most important or upsetting for each person, and then coming from a place of respecting that individual, their viewpoint, and their emotional experience.
That's so true. And I'm wondering about support groups, Dr. Secord. I know that over the course of dealing with cancer, especially if you don't really know anyone or you don't have a built-in support system, how can they be helpful? And what have you seen the impact of those kinds of support systems?
What I first see when seeing patients and you give this diagnosis is that suddenly they have this cancer and they need to retain all this information. You're talking about surgery and chemotherapy and all these things. It's like drinking from a fire hose. And you can get overwhelmed very easily. The good news is when I see someone struggling is that we have resources to help them. So I'll refer them to our cancer support group. And I find that is really helpful for a lot of patients and help them cope through a difficult time. The really positive thing about endometrial cancer is most patients are diagnosed with early stage disease and they have an excellent prognosis. In fact, right now in our country, there's about 600,000 individuals living with a history of or with endometrial cancer. And so the support groups can be really actually hopeful and helpful for those individuals as they navigate this new diagnosis.
I know that, Cheryl, you were going through treatment during COVID, which was a very isolating time, but you found a lot of support in an online community. Tell me how you were able to do that and how it helped you.
Well, as I was going through treatment, I was looking things up on the computer or on YouTube, and various sites would pop up with other people going through cancer. It might not have been the same type of cancer I was experiencing, yet we had similarities in our treatments and our own experiences. So listening to them made me realize I wasn't the only one in this fight. There were many others. Some were much more worse off than I was. So I guess in a way it didn't make me feel so alone because, like you said, Katie, we were just coming out of COVID. Even my husband couldn't stay with me during my treatment. He had to leave. And so it was a little isolating, but finding those groups online was a big help.
And Cheryl, how did you deal with sort of the dark periods? I'm sure that there were some moments where you felt a little overcome with anxiety and worry and your own mortality, frankly. And I'm curious how you were able to get through those dark moments.
Well, Katie, I think what got me through the darker times was the love of my family, especially my grandchildren. I was determined to live long enough to watch them grow up, graduate high school, go on to college, live their life. And the other thing that kept my spirits up was my love of walking and walking my dog, Maggie. So every day, no matter how fatigued I felt, I got up, got dressed, put my makeup on, and out the door we went. Sometimes I could only go for 2 short walks, sometimes a longer walk. But I always felt better when I returned home after my walk, and even with my mental health, it that really helped the mental part of it. And I think another benefit of staying active during treatment was I recovered so much faster. I think it was a couple months after my last treatment that I was back playing golf 3 times a week. I was walking Maggie, doing all the things I like to do. And my doctor was quite amazed when I came in for my 3-month checkups on how well I was doing. So I think I attribute all of that to getting out and staying active as much as I could.
What's your handicap, Cheryl?
Probably 6.
Oh, well, that's pretty good.
I've been playing golf since I was 10, so
Oh, well, no wonder, no wonder. But I think you're right, just being out in the outdoors, in nature, it's such a stress relief, and, I'm sure your doctor was impressed that you were in such great shape, and I'm sure that made you feel good as well. But, I think about doctors a lot, Dr. Secord. I asked you about how you tell people sometimes difficult news. But especially during COVID, I got very concerned about the mental health of our healthcare professionals. As Cheryl said, she had such great nurses. I have so much respect for nurses and doctors and scientists, but especially people who are dealing with patients all the time. And I'm curious how you've been able to be both empathetic, and which you really need to do as a doctor if you're a good doctor, and I know you are, but also not becoming so invested in every patient that it is just debilitating. So how do you manage that?
Well, I think one important thing is that this truly is a calling. We love what we do and we help people and we love helping individuals. It's a privilege to be in the practice of medicine and care for such wonderful patients, such as Cheryl. But physicians and care providers do have feelings and emotions like anyone, and sometimes it can get really tough. This job can get overwhelming, especially when you have to give a lot of bad news in a single day. And there's days that are so uplifting because, like today, I get to be here with Cheryl and she's telling her story, which is so awesome. And she's what I call a super survivor. And when you see someone like that in clinic or someone who has no evidence of disease, which we call NED, and that indicates that their current tests and their exam and all the scans show no evidence of cancer, you just get so excited and it fills me up with a lot of joy. And that gives me the energy to take to my next patient. So you do have to protect yourself, like you mentioned, Katie. There's this element of compartmentalization that is a little bit hard for me to describe, actually. But I also recognize that I need to continue to be vulnerable and let myself feel that patient experience so that I can truly provide the best compassionate care.
Cheryl, you, as Dr. Secor just mentioned, have no evidence of disease, which are three of my favorite words in the English language. We're so happy to hear that you're feeling good, you're walking Maggie, you're playing golf. But why was it important for you to participate in this conversation?
If I can help spread the word about the symptoms and risk factors to other women who might not know about endometrial cancer. I think it would help maybe with early detection and possibly save lives. Um, I think women need to pay attention to their bodies, and if something doesn't feel right, don't wait, go get it checked out right away. If I had waited longer, perhaps I might not have had such a good outcome.
That's true. And Dr. Secord, I am a nut about early detection. I try to talk about it a lot with breast cancer and with colon cancer, obviously, having lost my husband, Jay, to the disease. And I'm just curious what is going on about diagnostic tools for endometrial cancer because it sounds as if some of the symptoms could be mistaken for other things. Do you think that research is going on where there will at some point be a test of some kind for this for patients who may have early stage endometrial cancer?
Great question, Katie. As you mentioned, there's no standard or current screening test for endometrial cancer. There are endometrial biopsies that can be done, but we don't typically recommend that for routine screening. There is research that's ongoing, but it's not ready for clinical use yet. And we desperately, desperately need more funding for endometrial cancer, not just for early detection, but also just for treatment so that we can best provide care for our patients.
So, what do you think is the most important takeaway, Dr. Secord, for people watching this?
Oh, there's a lot of different important takeaways, but when you put it like that, I guess most important are symptoms. Monitor for those symptoms that we talked about: abnormal bleeding, postmenopausal spotting, or any other abnormal symptoms you don't feel right, contact your healthcare provider. Remember, a pap smear is not a specific screening test for endometrial cancer. So just because you had a pap smear recently doesn't mean that that can detect endometrial cancer. So a negative pap, when you have abnormal bleeding or spotting, still go see your healthcare provider. And I'm a little biased here, but I don't think you can stop going to see a gynecologist even as you go through the aging process. Important to continue to have exams, even pelvic exams, and talking to healthcare professionals with any concerns that you may have.
That's such an important point. And Cheryl, I bet your husband is really happy that you had such a positive outcome since he got emotional when you all were told the news. I'm so happy that you're doing well. And I think it's really selfless for you to share this because a lot of people keep these things private. But the more we talk about them, the more we increase awareness, and the more people will be aware of the symptoms and will really be on the lookout for them. And then, most importantly, as Dr. Secord says, they'll take action and they'll talk to a healthcare provider. I can't thank you enough for your time today. It was so great meeting both of you. Dr. Secord, thank you for what you do for helping patients everywhere. Doctors are such heroes. And I'm sure Cheryl is grateful for her doctor as well. And Cheryl, thank you. And I hope you have many, many years walking Maggie, playing golf, and enjoying that husband of yours who clearly loves you so much.
Thank you, Katie. I really appreciate that. And thank you, Dr. Secord, for bringing awareness of this endometrial cancer to others.
Yeah, absolutely. I was so thrilled to be here today. I really think this is a huge step forward to get the word out. Thanks, Cheryl, for having so much courage to share your story with us, and Katie for your excellent program and just making us feel so comfortable with this discussion. Just want to point out again, this cancer is on the rise. 69,000 women in our country will be diagnosed with uterine cancer this year. And unfortunately, 14,000 will die of this disease. So please learn more about endometrial cancer by visiting ourwayforward.com.